guys, so we just had our final IVF consult and we are actually starting our cycle in 10 days, give or take. And it's totally crazy because I thought we weren't going to be able to get started until May, but our appointment went really well. We met with our doctor for about an hour and a half and we went over everything, all of our plan for our cycle, the medications we're going to use, answering any of our questions, signing consent forms and all that stuff. We are going to be doing the antagonist protocol, and he said he's actually going to be treating me more like an egg donor in terms of the amount of medications, because he said that I have a really good AMH level, my ovaries look really good, and I guess they have a really good number of follicles on them. So he's going to try his best to get the absolute highest number of high quality eggs as possible. So I was really happy to hear that. He also told me I had a beautiful uterus, which is, I think, something that you don't really hear too often. We then met with our financial service representative, who was really helpful. We actually ended up paying for our entire cycle right there. We got all the prices for everything and just reviewed everything like that. And then we met with our actual IVF nurse, who went over all of our medications that we're going to be doing. We're going to be doing, we're going to be doing Gonal F, because I guess it was either Gonal F or Follistim, and Gonal F has a better price right now. So they had called around to a bunch of different pharmacies because we're paying cash, so they wanted to get us the best price possible. And then it was either going to be Cetrotide or Ganirelix. And I guess Cetrotide is cheaper right now, so we're going to be going with Cetrotide. And I'm getting Lupron because I might have to do a Lupron trigger, because he's thinking that I could possibly be a high responder, and it's better to do a Lupron trigger in that case to prevent OHSS, which is the overstimulation of the ovaries, and you don't want to have that happen. But I'm also ordering the normal HCG trigger as well. Let's see, I'm trying to think if there's anything else. Oh, and we're doing the progesterone and oil, the intramuscular. That one is going to be, she said because I'm smaller, I only have to have 1-inch needles. So that is obviously, sounds a lot better than, 1.5 or whatever the other option may be. So the entire appointment took about 2.5 hours. And I didn't have to do any additional testing or anything like that because we had already completed everything. Everything was already done. I didn't have to do a trial transfer because my doctor had already done my HSG. And he said that he had wrote down notes when he did it, which I guess is pretty much exactly what they do during a trial transfer. And so he filled out all that paperwork, and he said that especially since I did 6 IUIs and they had no trouble with any of the IUIs, so he said there was no reason for me to have to delay everything to do that, and I did not have to have a saline ultrasound because I had just had a HSG within the last 6 months, I think it was. I don't remember exactly when it was, but and he said that it was absolutely perfect, and he did the HSG himself, so he didn't think there was any reason that we needed to do anything else, and all of our blood work was done, and our genetic testing. So yeah, there wasn't any other testing that we needed to do. So now I just have to wait to hear from the pharmacy, so we can just pay for our meds. We're going to be getting our medication from a pharmacy in Maine. It's a mail order pharmacy. I think it's called Apothecary. I'm going to have to actually check on that, the full name of it. But they're supposed to be calling me either tonight or tomorrow, and they'll just get my shipping information and pay, and then my medications are going to be here in just a couple days. So it's totally crazy. So I'll have to update again when we have more information. All I have to do now is basically kind of wait. I have to review all of our injection teaching stuff. I have a big packet I have to read. We got 2 huge folders of stuff. And once I'm done reading everything, then I just call my nurse back if I have any questions, and that's pretty much it. We chose to freeze a sperm sample ahead of time, just in case, one of the things that they said could happen is occasionally, if the male partner gets the flu or something like that and gets a fever. So we figured that, we're going through the whole IVF cycle. That's a pretty easy thing to do. So we're going to be doing that just for peace of mind. We don't have to worry about you know, possibly getting sick or anything like that. So that's everything. So I'll do another update probably when our meds come in. So I can't believe it's happening.